Good afternoon, everyone. This is Dr. Jeff Gelblum. I'm a neurologist, and I'm coming to you from sunny South Florida today. And purpose of today's Facebook Live is to discuss the new information as relates to the treatment of Alzheimer's disease. Now, many of you who have been following the news are probably aware that as of June 7, 2021, just a few weeks ago, the FDA approved a new treatment for Alzheimer's disease. So what I want to do this afternoon is take you through that approval process, how the drug works, and to figure out who would be perhaps a good candidate for this treatment. So first off, let's talk a little bit about the history of Alzheimer's disease treatment. Well, basically, for the past 20 years, we neurologists have only had two classes of drugs that are able to treat some of the symptoms of Alzheimer's disease, but nothing that was able to address the underlying pathology of Alzheimer's disease. So it's kind of like if you're in the business of treating diabetes, well, I have a drug that will try and keep you away from the sugary foods, but I don't really have anything that's going to help the underlying elevated glucose in the bloodstream. So that's the problem that we've had for the past decades with Alzheimer's disease. Really nothing that could address or treat the underlying pathology. So let's talk about that pathology. We've had several Facebook Lives previously about what Alzheimer's disease is, mainly problems with memory and executive functioning or visuospatial or mood, etc. So we know what Alzheimer's disease is, and we can diagnose it clinically based upon memory loss with other functional deficiencies. But what we now know is that in the brain of an Alzheimer patient, there's the deposition of what's called amyloid plaque. It's kind of like a gunk that sits on brain cells, and it irritates the ability for neurons to talk to each other, for the brain to work. And historically, the only drugs we've ever had to treat clinical Alzheimer's disease were drugs that impact the symptoms, perhaps helping you a little bit with your memory, perhaps helping you with your mood. But really, we've never had anything until now for the treatment of the underlying physiologic disorder, which is seen as plaques on the brain. So the new drug that was FDA approved just a few weeks ago, June 7, is called Aduhelm, A-D-U-H-E-L-M. What is Aduhelm? Aduhelm is a monthly infusion that helps take away the Alzheimer amyloid plaques on the brain. That's how it works. Now, the issue is this drug good for everybody? Well, of course not. No drug is good for everybody. And certainly this drug isn't a holy grail or panacea for every patient with Alzheimer's disease. If we look at the Aduhelm data, the data that was submitted to the FDA for review and eventually led to its approval, we can see that certain folks did better than other folks who received the Aduhelm. We know that those folks who were mild to moderate, those folks who received higher doses of the infusion, it's an IV drug, that those individuals did better than people who were advanced or received lower doses. And that's where some of the conflict is in the literature. And you've probably read some of these conflicts in the New York Times or other newspapers on CNN, Fox News, etc. A lot of doctors right now, myself included, are debating who would be the ideal candidate for this drug. Because if you look at the data within the clinical trials that were submitted to the FDA, the data really show that significant response occurs best in those individuals who are mild and in those individuals who receive the highest doses of the infusion. So in my practice in First Choice Neurology, what we're trying to do is obviously identify patients who are mild, obviously patients who have amyloid plaque, and those patients who can tolerate higher doses. So unfortunately, I do not at this point believe that this medication is applicable for end-stage Alzheimer's disease, for folks in nursing homes, for people who are barely communicative, for those individuals who have multiple health issues whereby another treatment could aggravate their blood pressure or their heart, etc. So it's important that we doctors, we neurologists who are in the business of treating Alzheimer's disease, identify the appropriate patient to receive the treatment. So I want to remind you all, although the drug is technically FDA approved for Alzheimer's disease, if you really look at the data, those individuals who did best with the treatment are those who are mild and those who received higher doses. So obviously, in order to be mild, we have to catch the disease early. And in order to tolerate a higher doses, you have to make sure that the patient is relatively healthy and not having other severe disorders like cancer, end-stage heart disease, etc. So that's the first task at hand, is to identify clinically those patients who are mild. Right now in my practice at First Choice Neurology, we're identifying those patients. So what's the next step? Well, you come to me and you come with your spouse or your loved one or your family member or your next door neighbor, and everybody says, listen, Mr. Jones is having difficulty with memory, activities of daily living, forgetfulness with regard to paying bills, having difficulty with homemaking, getting lost while driving. All of these things suggest a dementia illness. So what we do in our office in order to clinically evaluate this condition is we do something called a comprehensive cognitive impairment assessment, which is a series of tests which test your memory, your mood, your ability to do activities of daily living, as well as your ability to have executive functions like arithmetic, drawing, visuospatial, all of those things. So if that evaluation is abnormal and suggestive of a dementia, the next step is to do a brain MRI. Because the brain MRI is going to make sure that you haven't suffered a stroke, that there's not a tumor, that there's not fluid on the brain, a condition that we call normal pressure hydrocephalus, because those things can somewhat be reversed very quickly. So it's important that an MRI be done as well as this clinical evaluation called a cognitive impairment assessment. So those are two very simple tasks that we neurologists do every day, non-invasive, no pain involved, paid for by Medicare, straightforward, very simple. And then the third task at hand is if those two tests, the cognitive impairment assessment and the brain MRI, are suggestive of an Alzheimer's disorder, the third component that we do is something called a lumbar puncture, a spinal fluid exam. What does that mean? That means that we put a little needle in the base of the spine, back here, no more invasive than a blood test, and we draw off about 5 cc's, about a teaspoon, sometimes a little bit more, of clear, colorless fluid that's called CSF, cerebrospinal fluid. And what do we do with that? We then send that off to the lab, because if that test comes back positive, and what we're looking for is specifically beta-amyloid in that CSF, in that spinal fluid, if that test comes back positive, then we can say, okay, there is a dementia illness, and there's about an 80 to 90% chance that this dementia illness is due to Alzheimer's. Now, I want to remind you, there are multiple causes of dementia. Alzheimer's just seems to be the commonest. But if you've had a gunshot wound or a stroke or a brain tumor or Parkinson's disease or schizophrenia, certainly you can have dementia on that basis. That's not an Alzheimer's dementia, that's another form of dementia. And the drug we're talking about today, this Aduhelm drug, is specific for Alzheimer's dementia. So we're not going to use it for anything but Alzheimer's. It doesn't work for anything but Alzheimer's. And the data suggest that it really works in those patients who have amyloid plaque in the brain and who are fairly mild and who can tolerate a high dose. So what we do in our practice very quickly, we can get this whole process done within about a week or so, is evaluate the patient, make the clinical diagnosis of dementia with a cognitive impairment assessment, do an MRI to make sure that it's not caused, that the dementia isn't caused by anything else, and then do a spinal tap to see the level of beta-amyloid in the CSF, in the spinal fluid that bathes the brain and the spinal canal. And if all those three items are there, then at that point we can safely say that if the situation is mild, that if you're in fairly good health, that you would probably be a candidate for this new drug called Aduhelm. So what about those folks who don't want to have a spinal tap? For those folks who say, well, I'm scared of needles, I don't want to go through that invasive procedure, I want to remind you that the spinal tap evaluation, we neurologists have been doing it for over 100 years. The side effects from it are minimal. Basically, what it involves is you go over to the doctor, the neurologist, you lie flat, we sterilize the area with some topical betadine solution. We put the tiny needle in the spinal canal. We draw off a little fluid, about a teaspoon, and we send it off to the lab, and you lie flat for about an hour. Side effects can sometimes be some headaches or a little bit of tingling in the legs, but really nothing of a severe side effect nature. Very straightforward test. And then we typically get those lab results back of the CSF within about 3 days. And then you get a phone call from the office and we say, look, the spinal fluid evaluation is positive. At this point, you may be a candidate for the treatment. Let's talk about that and let's consider that. In fact, I call it now the ABCs of Alzheimer's diagnosis. Assessment, clinically and with MRI. B, beta-amyloid, to make sure that it's present in the CSF because that's how the drug is working. And then C, consider the Aduhelm infusion. So it's the ABCs. Now, I know that sounds rather glib and simple. And of course, it's not a simple process. We have to go through a lot of evaluation and diagnosis and ruling out other things. But once we go through that process, we can safely say that you would be a good candidate for the Aduhelm drug. So you don't want a spinal fluid tap because you're scared of needles. I get it. We're all scared of needles. There's an alternative called an Amyvid scan, AMYVID. It's actually a PET scan. It's a nuclear PET scan. And what that means is a little bit of medicine is injected into the vein. You lie in the PET scanning machine, and that will also show the presence of amyloid plaque. So you say to yourself, well, gee, that's so much easier and less invasive than a spinal tap. And you know what? You're right. Except that Medicare nor commercial insurance, no one covers the performance of this Amyvid scan. And you say, well, that's kind of crazy. How could they not cover it? They just don't. So then you have to ask, well, how much is it? And the scan can sometimes be up to $4,000 or $5,000. So for most patients, that's pretty much out of the question. So that's why a simple spinal tap, which is covered by Medicare and commercial insurance, to me is the easiest and most cost-effective way to go, and it gives us very quick results. So again, getting back to the ABCs of Alzheimer's evaluation and now management, it's assessment, beta-amyloid evaluation in the CSF, and then C, consider the infusion. That is the new paradigm. And this paradigm, this discussion wasn't even possible last month. So here we are, June 23, 2021, and we now have the opportunity to, within basically 1 week, evaluate you and see if you would be a candidate for this new Alzheimer treatment. And the way the treatment works is it's a monthly infusion. You go to one of our infusion centers, you receive the medicine by vein, and then this is repeated on a monthly basis. And we think that if you look at the data over the 18-month time frame that people did receive these monthly infusions, they did better. Those patients who were mild and those patients who received the higher dose. So now you know basically the nuts and bolts of what it takes to diagnose an Alzheimer patient and what it takes to treat an Alzheimer patient. And the reason why I come to you today on Facebook Live is it's imperative that with any disease, and particularly Alzheimer's, that we capture those patients as early as possible, because the earlier we can get to you, then the better off you're going to respond to the treatment. So therefore, I'm appealing to any of you who are on Facebook Live or go onto our website and see this video later on, please share it with your friends and family. Because if you know someone who is suffering from an Alzheimer-like disorder, a dementia condition, the sooner you can get that individual to the neurologist to go through this ABC algorithm, the better off that patient's going to be, and the more likely that patient would be to get FDA-approved treatment as it stands now. So those are the nuts and bolts of where we are with Alzheimer's treatment as of this date, June 23, 2021. This algorithm did not really exist 4 weeks ago prior to the FDA approval, but as of June 7, this is the new algorithm. Assess, look at the beta-amyloid, and consider the infusion. For those of you who need to learn more about this whole process, please visit our website, firstchoiceneurology.net, which has a lot of useful information. And if you want to discuss the condition of a loved one, a family member, a friend, a relative, a coworker, then I invite you to go online, neuro2go.com, Neuro, number 2, go, neuro2go.com. And in that setting, you can have a teleconference or a video conference, a chat with a board-certified neurologist from First Choice Neurology, and we can discuss whether this algorithm, whether this diagnostic and treatment approach would be reasonable for you or a loved one. And in that case, we would then set you up for an evaluation and management where you would actually go in and have that individual evaluated and treated. So recapping, we shared a lot of information today. Neuro2go is the best place to have a neuro chat with someone like myself or one of my board-certified colleagues at First Choice Neurology to learn more about what goes into the diagnosis of Alzheimer's and what treatments may be available. First Choice Neurology is a great resource. firstchoiceneurology.net, you'll see it at the bottom of your screen, is a great place to learn more. Our website is constantly updated with up-to-the-minute information about diagnosis and treatment of Alzheimer's disease. And then I want you all to understand that this new FDA approval, although it's not a holy grail, and it's certainly not for everyone, offers all of us in the Alzheimer treatment space the opportunity to, for once and for the first time, treat the underlying condition and not just trying to clean up a smoggy window and hope for the best, because that's really where the treatment has been over the past 20 years, just symptomatic relief using medications that impact depression, anxiety, agitation, etc. So I appreciate all of you coming today. If you have any questions, feel free to visit our website or schedule a neuro chat with one of us at Neuro2go. We're here to help you. We're very familiar, all of us, with the data, and we will have that discussion with you if we both believe, both doctor and patient, that the treatment is the best thing for you. So I appreciate your attention today. I look forward to speaking with all of you further as you need, via neuro chat or in the office. All of us at First Choice Neurology are eager to assist and help navigate the path of dementia and come to the most effective treatment response possible. So I appreciate your time. Have a very great afternoon, and we're here for you. Bye-bye.